Can you take other stuff but still be sober? The idea for this has come from two reasons. The question of, like, are you still sober if you smoke a bit of marijuana or other recreational stuff, or if you take other medications? And I had a chat with a colleague last week about a friend who would switch from drink to smoking to whatever. But this was kind of highlighted to me because I've had a back injury that flared up last week. So I spent most of my weekend in hospital and had an awful lot of other highly addictive medications for the pain and what have you. But it just reminded me of a lot of the conversations I've had over the last however many years. You know, you might have heard of California sober, where they just smoke weed or whatever, only, you know, I don't know, other things, but just not booze, whatever you want to call it. And yeah, for me, this experience of having to take painkillers that are opioid based or diazepines, whatever, that batch, which are mind altering substances, which are, you know, they do get you high. And I'll start talking about my experience of this, because I've, like I said, this back problem I've had, when I have problems, you know, stuff like paracetamol or ibuprofen or what's the other one, Voltarol, it doesn't even touch the pain. Doesn't even touch it. You know, I have to have something like, normally I go for over-the-counter codeine and whatever, you know, cocodamol, codidromol, one of those. That's the only thing that's strong enough to make a dent in that pain. But obviously this time going into hospital, they've given me even stronger stuff. I mean, on the early hours of Saturday, I actually had to get ambulanced into hospital, and the only thing that would allow me to move to actually get out of bed was, you know, being on the laughing gas, breathing it in. That was the only thing that I could take that actually meant I could move enough for the paramedics to get me out of bed, into the ambulance, to the hospital. And, you know, then it was a whole concoction of stuff to allow me to move and start stretching the muscles to stop the spasms, etc., etc. Anyway, but it's this weird thing where, you know, I'm in there, and on one hand, I know that I have an addictive, I hate the phrase addictive personality. I like getting high. I like changing the way I feel physically and mentally. And on one hand, it's this hurts like I need something. And then there's the other side of my brain saying, don't overdo it. You can't, you know, it's like the angel and the devil on your shoulders going, have it, it'll make you feel great. And the other side saying, like, rein it in, you know, do it for the pain, don't go overboard. And I'm sitting there, I'm like, what do I say to the doctors? Do I say, it really hurts because I need more? And like, am I saying it hurts more and I need more because I want to feel the high of those painkillers, or is it because it really hurts and it's like, yes, I do want to take the painkillers so that it stops hurting, I can get out of bed. But I do like the feeling of when you have some morphine and codeine and diazepam and something else and all that going in your system. You're like, oh, this is nice. And then, like, you know, they send me home with my prescription and I've got like 2 weeks worth of strong painkillers, and it's like, gotta control yourself. Stick to the dosage. You know, don't like smash it all in 3 days and go, oh, I lost the boxes, which I could easily do. And yeah, and then part of my head goes, oh, and you know, I've got to wean off this stuff. Got to like wake up in the morning and say to myself, how much does this hurt? Do I need to take the full dose or the half dose? Can I take the half dose and I'll be okay? You know, this conflict, it's tough. I can't just sit there and go, I feel fine, I don't need it. So I go, yes, I feel fine, but I know that when I get out of bed and I start moving, it's going to hurt more. So even if you feel fine now, take something, because you don't want to start spasming in a few hours. And that logical part of my brain is is kind of enhanced by the other bit of my brain saying, take it because it'll feel nice. You know, being sober isn't easy, especially when you've got to manage something that hurts and the medication feels good. Yeah, it's a difficult situation to navigate, especially when I know that in the past I did somewhat abuse prescription medication. Not to anywhere near the extent that I did alcohol, but there were times when I took painkillers longer than I should, higher doses than I should have done. There were times when, you know, I would, abuse prescription medication. There were times when, you know, in my years of when I was trying to stop but relapsing, there were times when a relapse would start by me abusing prescription painkillers or sleeping pills. And it's scary. It gives me, like, this situation now of having to do that gives me these moments of remembering those times when I went too far, when the start of a slippery slope back to drinking was just some over-the-counter codeine and paracetamol. When it was just, a short-term prescription of sleeping pills to help me get to sleep. You know, those experiences sometimes, on a few occasions, led me back to full-blown active alcoholism. And then there's the other part of this I wanted to discuss. It's people who go from one substance to another. The substituting. And it was my colleague telling me about their friend who goes, oh yeah, I'm not drinking for a while, but I'm just smoking, you know, evenings, weekends. Or, you know, they're not drinking, but they might go out and do other recreational drugs. You know, and my colleague can see that they are always doing one thing to an extent, or one thing more than they should, but they're kind of kidding themselves by saying, oh, well, I can do I can do a few months of not drinking because I got this other thing to substitute it. And I'll stop doing that. So I'm not addicted to those. I'm not addicted to drink. I'm not addicted to that because I can stop any of them. But if I stop any of them, I still got to have something. It's that denial. The denial. I don't have a problem because I can stop for a period of time. And even if you're someone who can stop for a period of time and not have anything for a couple of weeks, couple of months, it's that knowing that eventually you go back to it. You kid yourself into thinking you're okay because you know that at some point down the road, all these little things that are building up at the moment, you're like, yeah, I'm having a bit of a tough time at the moment. Things are stressful at work. Things are starting to annoy me. But I'm doing my sober period. I'm doing my clean period because I'm not an addict. So I'm doing this sober clean period. And things are tough, but in a couple of days or weeks or in a month or two, I'm going to go back. And you hold on to that knowledge that then you're going to cut loose. Then you're going to have your blowout. And you do get people who come into sobriety saying, oh, well, I know I've got a problem with alcohol, but can I stop this and like maybe just have a joint at weekends? Or whatever other substance. Still want to have my blowouts, but I just won't do drink because drink's been the problem. I now recognise drink's been the problem, but can I just do that every now and then? Yeah. And that brings us back to these 2 points I've said. Are you the person that's substituting something to tell yourself you don't have a problem? Or are you at the point where I am now that I know that everything can be a step back to active addiction and I've got to be careful of everything? Even if it's prescribed by my doctor, I've got to be careful. But I do want to end this on a point of contention. Some people have varying views on this. And that is if you've been prescribed something either for medical reasons, be that physical health, pain reasons, or psychiatric reasons like depression or other mental health issues, I do not believe that that is against the idea of sobriety. There are people who come into recovery with existing mental health problems and they need medication. There are unfortunately certain people in recovery who say that if you don't stop your substance of choice and all other mind-altering substance, even psychotherapeutic medication, then you're not sober, and that's dangerous. Now, if you have a mental health problem that needs medication, do not stop that because some idiot told you that doesn't count as sobriety. Doctors prescribe medication for mental health issues. Yes, if you've abused it and it's become a problem, go back to your doctor and discuss it with them. But if it's something like you need to stop using alcohol, weed, other recreational drugs because that's the problem, yes, you stop those. But don't let someone in your local group tell you that you've got to stop taking your antidepressant meds, otherwise you're not sober. That's stupid. That's dangerous, and I've seen the negative effects that can have. So yeah, there's not a big point to this video. It's just me going over some stuff that's come up over the last few days. I hope that's helped. Catch you soon.